My name is Heather Bittner Fagan, and I am part of the Community Engagement and Outreach team. I am excited to have two colleagues with me today. So on the phone is Lee Pachter from Nemours and Allison Carpin from University of Delaware. So we all, work together through different domains of what the community engagement team does and through our different institutes. And this is really just meant to be an introductory and an iterative conversation about what is community engaged research, why do we, believe it's, really the magic pixie dust in the potion of translational research. And hopefully, I don't have a ton of slides, so hopefully this can be a little bit more of a discussion. So community engaged research, you can see, there's a couple of different definitions. It's really not so much a method, but a philosophy of engaging the community in what we do. So there's a really, and we'll talk about it more, there's a continuum of research possibilities in terms of, that you can, the way that you can conduct your research to include the community. It's really a value system that I'm proud to say that we've worked hard at Excel to accept that the voice of the patient and the community is a priority. And one thing I like to sort of clarify or distinguish, it's not a particular methodology. So for instance, community engaged research does not necessarily mean qualitative research. It's more the way that you might do qualitative research. And I think it's worth putting it out there because I think when people hear community engaged research, some people at least immediately go to CBPR or community-based participatory research, which is sort of one form, which is where really, everything starts with the community. They do the questions, they're the research team, they're the collectors, they're involved in really, driving every piece and part of that process. And while that is an amazing type of very powerful research, if you're not that type of researcher, I wouldn't want you to equate the two and be like, well, that's not what I do, so I'm going to stop listening. There's really a way for community engagement to diffuse into any type of research. So, and all of those pictures, they're not, they're not things I just pulled from the internet. Those are actually people in and around Excel partnering with the community to make our Excel research more impactful. And if I could have the next slide, please. So this is just an example of the fact that community engaged research can occur across the continuum, with CBPR being on probably one end of the spectrum in terms of the intensiveness. But there's opportunities, for sort of first steps that are less intensive, where you might involve the community in a discrete step, such as, there's a tool that you want to use and you're not sure it's really relevant for the population that you're serving. Or, you're trying to think about particular outcomes that maybe matter to your patients or community. So you might involve them in a focus group to see, what it is that really, matters most to them. And the example that I give there is, physicians and who study diabetes, we're often looking at this one blood test called hemoglobin A1C that measures people's diabetic control over 3 months, and we care about that. That's like a quality measure, and AHRQ and the hospital cares about that. But if you talk to the patient, they might really, really care about avoiding amputations, far more. So that's just sort of some fuel for thought. And I'm going to take a breath at this point and see if anybody has, there's more slides to cover, but are there questions or comments at this point before I move on to my next slide, because I do think this is best delivered in an interactive kind of format.
I mean, I know we work together, Heather, a lot, but I think one question that we always get is if you're not the kind of person who's already doing a bunch of community work, and it's kind of, like for me, I do community food work, right? So it's sort of inherent in the kind of work that I do, that it would only be natural that I would talk to the community. For folks who are doing other kinds of science, how do you answer the question, why does community engaged research matter to me? Like, why should I care about this besides just being, informed of how other people conduct their work?
Sure. I think, there's a long answer and a short answer. I mean, I think you get to the longer answer if you can work with that person, that researcher, to really understand their work. And then, maybe you can, kind of diagnose a place in their work where they would really benefit from a community connection. And the short answer is, for everyone, community, to help the health of a community or a person, to improve the lives of a patient or a community, in some ways, I think there's very little research going on that doesn't want to be at least pointed in that direction downstream. Now, it may not be that individual sees their specific work that they're doing right now in front of them, as having that next step, but everyone can, should, wants to be putting their work in that context of, like, downstream, I want to help the health, well-being of people or communities or both. And how do I, kind of keep my, my rudder in the water in a way that steers me towards that? And that's, why personally I think, why I strongly believe that community engagement can be part of all of this. And maybe it's, maybe it's not necessarily the work in your hands, but it's about the next team that you collaborate with. Maybe it's about, looking into the data about what the community cares about. Maybe it's asking the questions about, does this work the same way in every population, and why might it not? I don't know, Allison, what's your answer for or Lee? I think you guys probably have good answers for that same question.
Hey, this is Rob. I was wondering if I could comment. I know there's other two folks probably can comment too, but I have a comment flash that was going to be a question, but I'll make it a comment, and then maybe you help me understand better. But my enduring sense is that communities are what drive ultimately funding. So there's a big need for communities who can interact with funding agencies or help direct policies to understand what basic researchers are doing, so that it informs how they represent what they want. But there's also feedback for the researchers, and it's invaluable to find out early that this is not something that the community is going to be supporting, advocating for, kind of pushing for. And the model, there's a lot of patient populations in pediatrics where it's early on. The communities aren't very well organized. But if you go back in time, say 15 years, and think about the status of autism research then and where things are now, that was driven almost entirely by the ability of those communities, the communities that were interested in improving research and our understanding of autism, to get organized and advocate. We can talk about how that happens. It's not something that just happens with communities. It requires leadership within those communities. But those things never would have happened in a way that they did without interactions between the researchers who were trying and the communities who wanted work to be done, and the communities really advocating for more funding, more research. So for anybody that's doing any research at any level that leads to a potential treatment, it behooves them to interact with the community. So am Am I reading that correctly? Am I layering too much on top of what the benefits are of working with communities across the entire translational spectrum? Even if you're in an early preclinical model for disease X, meeting with folks who have, or families that have disease X or condition Y is important for you. Would you say that's true?
I agree. I think that's true. And in addition to what I think that I think what I was kind of emphasizing is the point that community engagement can make your specific research more impactful. I think what you're saying is a well-formed advocacy group can change the landscape of what gets funded. And I think that's, very true. I think autism is a great example. And, I do cancer screening research, and I think about, the breast cancer advocacy is a really powerful, advocacy organization. And then, to think about organizations like the Patient-Centered Outcomes Research, I mean, that organization, you will have, a representative from the community or the patient group, who, whether or not your work is pertinent. So I agree 100%. All right, should we go to the next slide? And so this is just sort of, a little easy pictorial to talk about translational research, right? Because Excel is translational research, and our particular, Center for Translational Research has chosen to very much put community engagement in the center. And I think that this pictorial gives you a good sense of why, right? Translational research is supposed to translate from the bench to human beings, to then actual patients, to practice in the hospital and the other settings. And eventually, right, we'd like to see this all go to population health, community health. And if I could find the perfect picture, which actually if you go to the next slide, it's a little bit better, it would not be a one-directional picture, but rather a circle, right, where the lessons that we learn out in the community feed back into the basic research that we're doing. And this is the hope and the dream of, a lot of the funding that is put into the National Institute of Health, for instance. However, we know that it is slow. It takes about 17 years for most things that are sort of discovered in the laboratory translate all the way through to affecting communities. So, and not only is it slow, we also know that it's not really equitable. So the things that we find at the bench, the very typical scenario is there's a finding, we decide to test it in humans. The randomized control trials are, often, sort of a select group of people of, they tend more often to be white, to be a certain socioeconomic status. They don't have, certain comorbidities, et cetera, et cetera. And what that often leaves us with is, data, evidence that doesn't translate to everyone. And then for other reasons, even when we feel like we have the best evidence that, would definitely be helpful, implementing that, getting that to actually happen in a fair and equitable way in all subgroups and all communities, it just, there's a lot of barriers that come up. So, we need to understand better how do you adapt for those barriers. Next slide, please. And so that brings us to Excel and the community engagement team and what we are trying to do. I gave some of this before, but first and foremost, we want to try and give voice and priority to the needs of our communities and patients. We want to integrate community engagement across all the components of Excel, and we really want to create and nurture teams that incorporate the values of community engagement. Next slide. And actually, this is a slide that I stole from Allison. And when we talked about sort of barriers and getting the findings from the bench out there into the population, things not permeating, it brings up this idea of sometimes it's not really so much about the genes. Sometimes it's far more complicated than the genetic makeup, the medicine that we're prescribing. It's about these bigger social determinants of health. And if we really are thinking about how do we want to impact the health and the well-being of patients and populations, we have to widen that lens and include those other variables in the formula. So financial and social and nutritional. And that is going to be a big part of figuring out how to make interventions impactful for, bigger populations. Next slide. And I just threw this up here as one resource. So if someone was sort of taking their first steps out there into working with the community, I think this workbook is very good. You don't have to it's set up that you could go from the beginning to the end with a partner and work through all of it. But there's also a lot of different worksheets and ideas, just something as simple as if you're beginning to work with a partner in the community, asking each other, what is your vision? What do you bring to the table? And what is it that, you feel is the most important, outcome of this work? So things like that. It's kind of a good beginner's guide for partnership and community engaged research for a new dyad, new research community partnership. So I put that out there. And then I don't know that I put another slide about this, but a great, simple, easy first step that you can do if you are registered on the Excel website, you can consult the CEO. So it's as easy as hitting a button, answering a few questions. We'll call you. Someone will work with you one-on-one to see, what needs might you have that we could help you with. Next slide. And I think that's it. So I will just say thank you for your attention, and comments and questions are very welcome.